Hello everyone, this is Dr. Pooja Netalkar. I am Senior Lecturer, Department of Prosthodontics. Today we are going to study about anatomical landmarks of maxilla. So we have seen these funny gifs where the old people are trying to blow candles, or when the politician is trying to speak, the denture falls off. So we don't want such a thing in a patient, right? That is why the anatomical landmarks are very important. These are the specific learning objectives for today. To know the meaning of an anatomical landmark, to be able to classify anatomical landmarks of maxilla, to be able to describe in detail individual anatomical landmarks in the maxilla and its importance, to be able to identify, classify and label all the anatomical landmarks of the edentulous maxilla. So why do you think the maxillary anatomy matters in a denture design? The maxillary anatomy is the blueprint for every upper denture. Identifying landmarks ensures dentures stay in place and are comfortable and don't injure the delicate tissues. So to know a little bit of background, so what is an impression? A dental impression is a negative imprint or a positive digital image display of an intraoral anatomy used to cast or print a 3D replica of the anatomical structure that is used as a permanent record or in the production of a dental restoration or a prosthesis. So you can see the image here. That's an intraoral scanner. What is a cast? A dental cast is a positive life-size reproduction of a part or parts of the oral cavity. This is an impression and the cast, respective impression and their particular cast. So why do we actually study landmarks on a cast? So landmarks actually tell us where the denture can support, where we need to give support, where we must provide relief, and where the denture or the flange border must end, that is the limiting structures. So to know the definition, they are the specific points or regions in the oral cavity which are used as guides for designing and fabricating an optimal denture. So there are three classes of landmarks in the maxilla. You have limiting structures or the limiting borders, supporting structures or the stress bearing areas, and the relief areas, that is to avoid excessive pressure or the force. So as I told you, there are like three sub-classification of the landmarks of edentulous jaws or the maxilla. Limiting structures are nothing but the structures which limit the extension of the maxillary and mandibular complete dentures. They are the border limiting areas. Supporting structures, there are certain tissue areas or regions in the maxillary and the mandibular edentulous foundations which are suitable to bear the stresses, that is the masticatory forces. And the relief areas are the tissue areas which are not quite suited to take up these stresses, either due to their anatomy or due to the structures that lie beneath them, and they are the ones, or they are the structures that needs relief, that is called a relief area. So let's enlist and let's talk about each of the structures in the particular subclassification. So first you have limiting structures. In that you have labial frenum, labial vestibule, buccal frenum, buccal vestibule, hamular notch, posterior palatal seal area, anterior and posterior vibrating line. Supporting structures include primary and secondary stress bearing areas. Under primary, you have two landmarks, that is the horizontal plate of the hard palate, which is lateral to the midline, and the crest of the residual alveolar ridge. In the secondary stress bearing areas, you have the rugae area and the slope of the residual alveolar ridge. Relief areas, you have four under the relief areas, that's a landmark. That is mid-palatine raphe, incisive papilla, fovea palatini, and palatine torus or tori, plural form. So first of all, what are limiting structures? Limiting structures define the maximum extent to which a denture must cover or to denture must limit before impinging on movable or sensitive regions. So why do you think the borders are important? The border design prevents sore spots, that is soreness, helps with retention and prevents dentures from becoming loose during function. So in that first landmark, that is the labial frenum. So a labial frenum is a thin fold of tissue extending from the upper lip to the midline of the ridge. So in dentures, you must provide a V-shaped relief, that's a labial notch, to provide discomfort as the frenum moves. That is the initial first landmark, that's the labial frenum. And one must remember that there are no muscle fibers or no muscle attachments with respect to labial frenum. Now coming to labial vestibule. In a layman term, vestibule is nothing but a space between the cheeks and the ridge. So labial vestibule, which is towards the labial side of the ridge, that is, the vestibule is a space between the lips and the ridge, that is with respect to labial vestibule. So denture flanges in this area should not overextend to avoid instability. Next is buccal frenum. So a fold of tissue near the canines, the buccal frenum is activated during smiling and chewing. The denture must have a notch to accommodate its movement. So one must remember, unlike labial frenum, where there are no muscle attachments, buccal frenum is having 3 muscle attachments, most important, that is buccinator, levator angula oris and orbicularis oris. So these muscle fibers attach to the buccal frenum, and that is how it is activated during functional movements, or the smiling and chewing movements. So one must remember the 3 muscle fibers: levator angula oris, orbicularis oris and the buccinator. So that is the buccal frenum. Moving to buccal vestibule. As I talked about labial vestibule, buccal vestibule is present in the buccal region, that is the space between the cheek and the ridge. So it extends from the buccal frenum to hamular notch. So its record adequate depth or width, and improper extension causes instability or soreness. So the buccal vestibule is extending from the buccal frenum to the hamular notch, unlike your labial vestibule, which is between the lips and the ridge, that is from in the labial side of the ridge. Buccal vestibule. So extending from the buccal frenum to the hamular notch, this region limits the lateral extension of the denture. Overextension can cause impingement and soreness. So moving on, we have covered labial frenum, labial vestibule, buccal frenum and buccal vestibule. So now moving on to hamular notch, which is the posterior border key. Now this is one of the important landmark. It is distal. It is a structure which is distal to the maxillary tuberosity. As you can see where the mirror is pointing in the picture, that is aiding in locating the posterior palatal seal area. And one must not overextend your dentures or your impression, because if your impression is overextended, your denture also becomes overextended. So overextension causes soreness. Located between the maxillary tuberosity and the hamulus, this notch is crucial for creating a seal at the back of the denture. So this is a structure located just behind the maxillary tuberosity, and it's between the maxillary tuberosity and the anatomy of the maxilla, that's the hamulus part. So that's the hamular notch. Okay, so next important structure in the limiting structures of the anatomical landmarks of maxilla is the posterior palatal seal area. Now this is a cupid bow shaped structure located posterior to the hard palate. So anteriorly you have anterior vibrating line, and posteriorly you have posterior vibrating line. So the area between these 2 vibrating line comprises of your posterior palatal seal area. It is also called post dam area or post palatal seal area. This is very important in giving the denture a posterior seal. So it extends from one hamular notch to the other hamular notch and aids in retention, in simple words. As I talked about vibrating lines, you have anterior and posterior. So anterior vibrating line is the imaginary line located at the junction of the attached tissues overlying the hard palate and the movable tissues of the immediately adjacent hard palate. Remember, posterior palatal seal is a cupid bow shaped. Now anterior vibrating lines are located by Valsalva maneuver, that is closing your nostrils and blowing through the nose, and you're supposed to say short vigorous bursts of ah. Now posterior vibrating line, on the other hand, it's a junction of aponeurosis of the tensor villi palatini and muscular portion of the soft tissue. So in this, like how you have short bursts, vigorous bursts in of R pronunciation in anterior vibrating line, in posterior vibrating line you have normal unexaggerated fashion for a posterior vibrating line. So anterior you have short vigorous burst, posterior you have normal unexaggerated fashion. So this one has to record during border molding. So now to put it in a very simple way, anterior vibrating line is the junction of non-movable and slightly movable, and your posterior vibrating line slightly movable and fully movable parts of the palate. So but the actual definition is what I told before. Now the entire area between your anterior and posterior vibrating line is your posterior palatal seal area, or the PPS area for abbreviation. So there are a lot of functions involved in a PPS area. So it helps with retention, prevents food ingress, and compensates for the acrylic shrinkage during processing. So there are like 4 major functions, or the importance or the significance of posterior palatal seal area. Number 1 is aiding in retention, as I told, the name itself tells, right? Posterior palatal seal area. So that is aids in retention of the posterior palatal seal part of the denture. So once it is, once the importance is that it is, helping in sealing of the denture. So one can, guess the second function, that is helps in preventing the food accumulation or prevents any leakage of the food from the posterior part. Third one is the compensation for polymerization shrinkage. Fourth one, reduces the tendency for gag reflex due to downward movement of the denture during incising. So if it is overextended, you can have a gag reflex because of the muscular part of the soft palate. So just a quick recap. So helps with retention, improve phonetics, reduces gagging, and prevents food seepage beneath the denture. Now you can now moving on to, we have covered limiting structures. Moving on to supporting structures. I told you all in supporting structures we have primary and secondary stress bearing areas, or supporting structures are also called the stress bearing areas. So these are the regions of the mouth that absorb and distribute chewing forces safely. So choosing this correctly prevents denture movement and tissue damage. Key properties of stress bearing zones. The best areas are covered with thick firm mucosa overlying dense well mineralized bone. Now the primary stress bearing areas are the 2 landmarks, that is for a maxilla it is different for a mandible. For a maxilla it is the crest of the residual alveolar ridge and the horizontal plate of the hard palate, the horizontal plate of the hard palate lateral to the midline. So these are the primary stress bearing areas. So why? It's because they provide a good support. It could be due to the density of the bone, like the maxilla, the crest of the maxilla has a good bone density, and that is why we have primary and secondary. They are capable of taking up maxillary load, or the occlusal or the masticatory forces. They are the bone, the density, the quality and quantity of the bone is capable of taking up masticatory forces or the loads. That is why it is called stress bearing areas. So now you have the crest. Now crest of the residual alveolar ridge may support the denture if not resorbed, but loses value in advanced cases if there is resorption. On the other hand, now we have covered the primary stress bearing areas, which is the crest of the residual alveolar ridge and the horizontal plate of the hard palate. Now moving on to the secondary stress bearing areas, or the that is the rugae, and the now palatal rugae and posterior lateral slopes support the anterior and posterior denture, but not designed for heavy chewing forces. That is why it is classified under secondary and not primary. Now they are nothing but irregular shaped rolls of soft tissue, secondary stress bearing area. That is, it should not be distorted in the impression. So in per se, rugae aid in speech and prevent the denture from sliding. So that is the importance of the clinical significance of rugae, that is aid in speech and prevent the denture from sliding. So that is the picture in the impression and the patient's mouth. Now we have covered your stress bearing areas, your limiting areas. I classified, like we have seen the first slide, that we classified maxillary landmarks into 3, that is limiting structures, your relief areas, and your stress bearing areas. We have covered the first 2, that is the stress bearing and limiting areas. Let's move on to the last part of the discussion, that is the relief areas. Now when we have certain areas for stress bearing, why do we need to relieve certain areas? That's because they are not capable of taking, like some regions cover nerves. There could be some important nerves or vessels that is passing by, or we need to relieve those structures when you are constructing a denture, because impingement on these structures would cause some kind of soreness, inflammation, irritation, and that would cause redness in the patient's mouth. So some regions cover nerves or blood vessels, have thin mucosa, or are not suitable for pressure, in simple terms. That is why, and this pressure could cause pain or tissue injury, and that is why we need to relieve them when we are making a denture. That is why they are called relieving structures or the relief areas. Now the first relief area is incisive papilla. Now this is a small structure just behind your central incisors. You have 2 central incisors and there's a midline, right? So just behind that you have incisive papilla, as you can see in the picture with the arrow mark. So it's located behind the front teeth, that is the maxillary anteriors. It is an exit for nasopalatine nerves and blood vessels, and always provide relief in the denture. Otherwise it could cause paresthesia because of the nasopalatine nerves and blood vessels. Now mid-palatine raphe, that is the second relieving structure. Now that is, it's a midline seam of bone that is very thinly covered by mucosa. So direct pressure here causes chronic soreness and must be relieved. So that is located in the midline of the denture. As you can see in the picture there, it's the mid-palatine raphe or the median suture area, which is located in the middle part of the entire palate. So that is, it's very thinly covered by mucosa, and that is why any pressure could cause pain and instability of the dentures. It will act like a fulcrum, causing instability of the dentures. That is why it has to be relieved. Some patients do have a prominent mid-palatine raphe. So that's in the midline area of the palate. Now next you have fovea palatini. It's just not a landmark. Now why? It's because these pits have no functional value except for to find the vibrating line. Probably it's not really prominent in all the patients. Some patients, yes, it could be prominent. Now it could help in finding the vibrating line, or in other words, it's just that a pair of mucous gland or duct orifice is seen at the opening of this fovea palatini. So it is a pair of mucous gland duct orifice near the midline. So that is the only significance of fovea palatini. Always remember, mucous gland duct orifice. That is the pair of mucous gland seen. So that is why it's called it is a relief area, fovea palatini. Now the fourth relief area, that is your torus palatinus, or the plural form tori. This is a hard bony swelling on the midline of the palate. Small tori can be relieved in the denture base, and larger ones might require surgical excision or surgical removal. It could be anywhere in the palate. It could be in the midline, as you can see a few clinical pictures there, or a schematic or a diagram which is on the left hand side, where you can see multiple, not really seen in a clinical scenario, but that's the hard bone swellings which has to be removed if it is in a larger in size, or if it is smaller ones could be relieved when you're fabricating a denture. Smaller ones could be relieved. So this is a picture to be remembered and registered in your minds, that is the anatomical landmarks of maxilla. Now we have a beautiful picture here, which the different pencils, or different color pencils have been used, and the different landmarks have been marked, so that you know the difference of each structure. So application and clinical considerations, I've already talked about a few clinical significance then and there when I'm talking about the anatomical landmark, but just what are the consequences of not considering these landmarks. One is it could cause denture instability, or if the relief areas are not relieved, it could cause pain, ulceration, patient dissatisfaction, or if, for example, if the incisor papilla is not relieved, it could cause paresthesia. So there are like a lot of consequences of not considering anatomical landmarks. So overall, I can say that they are very important to know for all your students, because it helps in impression making, the type of spacer that you want to choose for an impression, or in general the type of the material you want to choose, or the impression technique you want to choose while making an impression. So all of these three factors which I talked about, choosing an impression material, choosing an impression technique, and considering this landmark while you're constructing a denture, that is you're making a denture that is for your spacer designs and everything, and the consequences, what could happen if you have not relieved a denture, or you've given too much stress or too much pressure on a particular landmark of a denture. So all of this can have certain consequences, and that is why it becomes important to know about the landmarks. So this is if a border is under or overextended. Underextension can cause reduced retention, overextension can cause instability, soreness. So to summarize, or to put it in a nutshell, we have talked about the three subclassification, that is we have categorized under stress bearing or the supporting structures. We have talked about all the primary and the secondary stress bearing areas. Under primary you had 2, and under secondary again you had 2. Now relief areas, again we had 4 relief areas, and limiting structures we had around like 7 to 8, all the frenums, all the buccal and labral vestibules, and the hamelin notch, where your denture has to limit. So it is simple to understand that way. And we have talked about the clinical significance of each, particularly why not to give pressure, why to give pressure, and what happens when you give too much pressure, and which structures to relieve and which structures to give support or give the stress. So it could be an important question for you for your exam, and these are my references. Thank you.